Thanks to those of you who've joined our webinar slightly earlier on time. We'll just leave it another minute or two for those who I know are coming to join. So probably just enough time to make a quick cover if you've got a fast kettle. And we'll start then promptly at 11:32. Okay, we'll make a start. Thanks for joining our webinar on this beautiful day in Suffolk, our amazing county. This is also 20th of May, National Thank a Teacher Day. So I want to thank all teachers in Suffolk for what they do and what they're about to do. Teaching, like safeguarding, is an all ages public service. Teachers are part of our wide and extensive safeguarding network in Suffolk. They play a key role in keeping children safe. And that's what our webinar is about. It's about safeguarding children during COVID-19. My name's Anthony Douglas. I'm the independent chair of the Suffolk Safeguarding Partnership. And just to say a tiny bit about that, the Safeguarding Partnership is made up of the main statutory agencies in Suffolk: health, the police, social care, education, but also hundreds of other relevant agencies who carry out safeguarding as part of their everyday work. That might be an individual school, a playgroup, a day setting. It might be a youth service, a church, and our very extensive voluntary and community sector, literally hundreds of colleagues involved in safeguarding. So the webinar is for all of you. I'm going to explain this morning's programme. It will last until 12:15, may finish a few minutes before, but it will definitely finish by then. And I'm going to spend about 15 minutes introducing the issues that, particularly those that will arise during the next few months. And then I'm going to have a conversation with two of our practitioners, Tracy Whitaker and Glenice, we're going to be talking about the current issues from a perspective of frontline practitioners. At the same time, our Q&A panel, who's going to be Cindy Dunkling from Health, Ali Hassi, who's Head of Safeguarding and Social Care, and Tracy Murphy, who's our Professional Advisor in the Safeguarding Partnership. They're going to be answering questions online, as you can see them come up in the pane. They can be technical, detailed questions or big issues. And then towards the end of the webinar, I'll try and feed back in some of the main points coming out of the Q&A panel. So that's roughly how it will last. 15 minutes from me, 15 to 20 for the conversation with Tracy and Glenice, 5 or 10 minutes to sum up. And then I'll just explain where we go after that. So I hope that makes sense. And this is very much a conversation-based webinar because our work is conversation-based and relationship-based, despite the lockdown and working remotely most of the time. So what I wanted to say really is that safeguarding is a multi-agency emergency 24/7 service. It hasn't stopped during the current pandemic. Abuse and neglect haven't been put on hold. It's just that many children and young people who were hidden in plain sight are now hidden out of sight. And of course, there's a worry about what's happening to them. It's also true that their voices, children's voices at the best of times, are hard to hear compared to powerful adults. So their voices during the lockdown will be even quieter, which means we have to listen even harder. And as the restrictions ease, pay a special attention to what children are saying. We know from the Suffolk Mind Study that one of the issues for people at the moment from their emotional needs audit is this is a period of high and charged emotion. Just as safeguarding work is charged emotional labour, so the current lockdown period is not a neutral, pleasant experience for many people. It's raised anxiety levels for different reasons. It's left some individuals disoriented and not at all confident about the future. It's taken away public space, taken away familiar reference points. So it's very important in our work to restore the confidence, particularly working with vulnerable people who don't feel that confident to begin with. And one of those studies showed from Mind the need for people to have more meaning and purpose in life. Somehow the stripping out of everyday life has taken away a lot of meaning and purpose. So these are important reference points to be aware of as we return to some degree of normality. But as the webinar is going to focus on, it won't be life as we knew it. It'll be a combination of what was before and then what we've learned during this incredibly intense 9 weeks. So we could call it a blended safeguarding model, making much more use of remote working in the new normal. We're also going to say a little bit about the legislative changes the government's introduced during this period, but not much, because one of the brilliant things about Suffolk is standards haven't slipped. They're bound to have been problems in one or two individual situations. That's inevitable. That always happens, possibly even more, because we're not aware of so many situations. But nevertheless, there's been no need to make extensive use of the easements and the more proportionality, particularly with reviewing. And I'm pleased to say that standards have pretty much kept pace. And then, as I say, we'll move on to Tracy and Glenice's frontline experience. So moving on to the next slide, which is about the new normal and the Suffolk picture. I just want to say a little bit about current trends and data without worrying excessively about it. Referrals are down, but significantly, serious referrals are a higher percentage of overall referrals, which tends to mean that what is being referred are the more serious situations. So that's encouraging. We know that there are particularly difficulties with domestic abuse and mental health. That's not surprising, and we need to be sure that services keep pace with that. And certainly with domestic abuse, some of the reports I get is of some pretty intense support for people once they're aware of the domestic abuse situation. We're worried about admissions to hospital being down and many children not being in school. And those are real concerns, but I would worry more if by September to December, referrals will still be down. I don't think they will be. This referral picture always happens in a crisis. And there's no question that with the needs people have will recover once we get out of these restrictions. And probably by September, when we track month by month referrals, and when we compare an autumn month with last year, it'll be much the same or slightly more. But the picture in Suffolk, I think, has been characterised. I just want to pay tribute to the army of volunteers, 1,800 volunteers signing up for the Tribe app, the Home Not Alone service, the 42 food banks, the myriad of services that are there with innumerable acts of local kindness and caring for vulnerable children and families. So despite the risks of carer breakdown and pressure, services are holding up pretty well. That's what I hear, and I don't think it's an illusion, because I work in a number of different local systems across the country, and Suffolk is certainly characterised by being the closest to business as usual, but carried out in a slightly different way. So then we're going to move on to what is the new normal. What is important is to look at the cycles of infection. The cycles of this particular infection or new infections may be a feature of our lives for some months or years to come. We may have to get used to these restrictions lessening and then tightening again. So the way we're working in this blended model is important to maintain in the longer term. This has led to an absolutely huge increase in remote intervention. Zoom has gone from 11 million users pre-lockdown to 455 million users now. Its security has got much better, so we should be able to make more use of Zoom in the future. That's important because the remote technology used by professionals like Microsoft Teams is not cheap. Certainly for families, the wrong side of the digital divide and without resources. So whereas now a family would have to go to access a conference, perhaps into a school, to access Microsoft Teams or one of our offices, then really we should be moving on to a platform like Zoom that enables full equal access by children and families to remote technology. But two examples that show how quickly things have changed in the last few months. Judges are being trained at a rapid rate to carry out remote hearings. Case management hearings in public law cases will have to be timetabled at 1 hour each and be carried out through CVP, which is a video conferencing platform. Most universities have redesigned their entire curriculum in the last few weeks to be providing online courses from September. So what's been achieved in a few weeks will have a lasting impact. And many children are saying they're communicating far better and for far longer periods of time with their practitioners through use of WhatsApp and through other technologies like text, Skype, so that actually face-to-face, whilst it's crucial in some cases and in some work to get the feel of a situation, actually is harder for some vulnerable people to use. We know that anyway from experience. So we have to get better as professionals with remote technology in order to keep up with the people we're working with. Victims of domestic abuse also are telling us that for some of them, moving away from having to be in a court setting with their abuser and to simply have paper-based hearings is a great advantage. Of course, that's being opposed by people who are accused of abuse and their legal advocates as not giving them a fair chance. But if you're on the side of victims, then this is potentially a time when their lives could be made easier in terms of navigating the system. And then in terms of some local systems, some businesses, even central government is looking at this, to give Chromebooks and the like to children and families to be able to play an equal part in remote work. And I think that's particularly important to get at the lived experience of children, because often if as a professional you see a child once or twice, 3 times, you will only be understanding that child's experience at that point in time you see them. And if you can be in more of a continuous dialogue with a child at risk, that's ideal safeguarding practice. Of course, there are risks of that child being manipulated, someone being in the room with them and so on. But social media is, as we know, can be made more private than any other form of communication within a family. And so it's really important to see it as an access to justice and an access to full equality in service delivery. Just a quick look at the voluntary sector, particularly VCSE, and the support being given by the everyday army of safeguarders. I want to pay tribute to them because in this world we're in, organisations are far looser. The hold that organisations have is much more distributed, it's loose, and they're more dependent upon the army of safeguarders out there in local communities. So when the pandemic eases, it will be crucial that they don't simply allow those volunteers to walk away. That's happened with many of the national schemes that people have signed up and never been contacted. So it's really important that with our volunteers linked into the voluntary and community sector, that their role is clarified and the role they can play permanently in safeguarding, particularly if they know a particular family, is made clear, legitimised and supported. We're all very worried about the resilience of this sector and the risk of financial collapse over the next 6 to 12 months. So corporate teams, corporate organisations have to be acutely aware that this capacity is not lost to safeguarding. I'd like to say just a little bit about the rhythm of this. The remote working has changed the rhythm of everyday life for both people providing services. That's why it can be disorienting if you're in your own room for every single meeting. You're never with people. But it's just as disorienting potentially for the people using services. They have to get used to a different rhythm. So to understand that change in rhythm, that risk of disorientation is crucial. And for professionals, more emphasis has to be placed on your own personal judgment. You're not, even if you're well supported and overseen, you feel out there more on your own, paradoxically, when you're inside on your own with the work. And that places an even bigger emphasis on the support you get. And then finally, in a more disaggregated, distributed world, the messages we give everybody need to be as simple as possible. So support and simplicity. Okay, I'm going to just quickly now look at the legislation. And only to mention that this hasn't been used to any significant extent in Suffolk. I'm very proud of that. Very proud of the work everyone is doing to maintain standards and still try to improve them. So talk of, well, not doing certain things until September has never really come about. Of course, there are some delays in multi-agency working for a whole host of reasons, but there always have been. If you're in a specialist case, it has often taken months to get, for example, a toxicology assessment in a child protection case. So none of that is new, but I can't see in Suffolk any serious pandemic related delays to worry about. And what's important to say is that the easements that are on offer from government don't change the core legislation for children in need, children who need protection, or children in care, or children with serious medical conditions, or contextual safeguarding in terms of county lines. Although what's interesting is that county lines, the break has changed the pattern of dealing and has allowed some workers to have better conversations with the young people they're working with about how to try to escape that pattern and pressure they feel within a county line. So it may well, in terms of restorative practice and reparation, be helping many young people. But there's no change to basic legislation, to the Human Rights Act or to the Equality Act. Then just a final couple of points. I think what I would say about social distancing is that is going to be here to stay. It's behind some of the difficulties in the reopening of schools, and I want to say a little bit about social distancing in safeguarding before moving on to the conversation with Tracy and Denise. And I just wanted to say that whilst it's important to have a presumption of social distancing, in practical terms, that does become difficult when you are visiting someone in their own home, which we're not compromising on. If a home visit needs to be made for whatever reason, That's properly risk assessed, but it's not stopped. That's really important to say. But obviously home visits should, where possible, be socially distanced. But our work is about emotional connection, relationship-based practice, close contact, proximity, and trust. And to do that, you're normally within 2 meters of the person you're working intensively with. So at the very least, it's an adjustment to the same conversation socially distanced. And you have to both, all of you, work harder to make those emotions connect over 2 meters. And then from time to time, that just won't be possible, as I think Glenice is going to talk about in one example, especially with young children, which is exactly the same for teachers. You can't, in a class or a playgroup with 3 to 6-year-olds, particularly in reception in year 1, you can't maintain 2-meter distance at all times with young children. And what is crucial in our work is to make sure that, as far as possible, any measure we take doesn't expose staff to risk, professionals to risk, volunteers to risk, but also doesn't expose children and families to risk. So it does place an emphasis on some of the measures that we're talking about before a visit's made, that have been very good RAG rated in Suffolk, staying here in perpetuity. It's a very different type of work, but it's really important to feel confident when you're in that home situation that you're safe, so that you haven't got 1 foot out of the door. Right, we're going to move on to discussing with Tracy and Glenice some of the big issues they're facing in their practice at the moment. And I'd like to introduce Tracy Whitaker, who's one of our independent reviewing officers. Our IROs in Suffolk work with around 60 children and young people at any one time. And Glenice Rogers is one of our frontline social workers working in coastal South, Felixstowe, villages around East Ipswich, so in the southeast corner of the county. So thanks very much for joining us, Tracy and Glenice.
Hello. Good morning.
I'm going to start by asking Tracy, although really the questions could be answered by either or both. We'll just be flexible about that. The first question is, what's been challenging for you working during the lockdown period?
So in terms of conferences, it leads on a bit from what you were saying. Part of the conference is meeting parents before the conference begins, and they might arrive feeling very angry, very afraid, and it's the lack of that physical opportunity to reassure them and build a rapport to help them contribute and take part in the whole conference. So the change from going to a face-to-face conference to just an audio situation brings quite a different way of working to the forefront. And during the conference itself, when I'm in a room with a group of people, I'm looking to the parents, how they respond to the comments that professionals are making, and trying to give them the opportunity to talk and share their views, their explanations, or ideas of what they can do to improve the safety of their children. So by doing it just through audio, I have to change the way that I work to make sure that I try and tease out with the parents the thoughts they've got about what's being said about the care of their children. And likewise with the professionals, everyone comes with different information to share. I need to make sure that everyone has that opportunity to fully share the information as they would if they were face to face. So what I lose is the nuance of body language, of non-verbal cues to look out for when people are sort of raising their hand, raising their eyebrows, and I would know that they wanted to say something else. So I have to spend a little bit more time just making sure over the telephone calls that it's possible for them to do that. I think another challenge is technology itself, to make sure everyone has full participation, that people's connectivity is good, that parents can hear what's being said and professionals can hear what's being said. Then hearing in itself brings its own problems, because of course the meeting is still confidential. If you're in a room, it feels much easier to say to someone what's in this room stays in this room. But of course, you're talking to people who are in their living rooms or in their family homes. So it's just getting that message across that the notion of confidentiality stays the same for families and for professionals, that you need to be mindful that you're in your family home, and that information shouldn't be heard by anyone else. And I think the other thing I'd just comment on is the way that we conduct our conferences is based on the signs of safety model. So if anyone has come along to any of our conferences, you would know that we use boards all across the room. It's a very visual way of understanding what a risk of harm to a child is. I'll ask people what are the things you're worried about, and what are the strengths the families have got. And from that, as the conference goes through, I'm developing a plan that everyone can see on a board. People can see what the worries are, people can see what the strengths are, and they can see what the possible parts of the plans might be. So by doing it in just an audio situation, I have to adapt the way, again, that I'm working, because people can't see it anymore. They're relying on me to keep reminding them and summarise for them in a way that they're hearing, as opposed to a way that they're seeing. So I think we've spent a lot of time helping people to visualise what we're talking about, and now it's going back to helping them listen to it and process it in a different way. So I think there's some of the key things that I'd talk to you about that have been challenges for me.
Yes, thanks, Tracy. And certainly professionals report that attendance at conferences has never been better.
Well, yes, yeah.
To join, just half an hour or so. Yeah.
Well, in terms of attendance, what I really notice is that some parents that perhaps would find it difficult to attend are now present, and I particularly thought about young dads. I've really noticed that oftentimes in face-to-face conferences, the young dads might absent themselves, but over the telephone, they're often there with the mums, and they participate in a much more helpful way to them and for us trying to understand risk than I've ever experienced before.
Thank you. Glenys, anything to add to that?
Well, I think picking up on what Tracy's just said, and what we have also noticed, the young people are more inclined to join in the meetings now, and we are getting more people because I think it's less hassle, there's no travelling, and for them to be at the end of a phone, it doesn't seem as intrusive for them. So we are definitely seeing an increase in, as I say, a lot of young people as well as other family members. So it seems to be more accessible to more people.
Okay, and in the question which was about the challenge, is there an example of how you've overcome a particular challenge during this lockdown period?
Well, if I draw upon when you mentioned before about the young person when I had to do a home visit, and it's a young child that I've been working with for a number of months now. So I feel I've built up a good relationship with her and her sister, and she went to run over to me. And suddenly in a time of crises, I'm having to tell her to stop, but finding very quickly in a child-friendly way how we can overcome that. So we were able to speak about the virus, and we played the jumping 2 meter game. And she was happy with that, but that was a sort of an example of how we have to change our practice very quickly and think about everybody's safety, because not only am I going into other people's houses, I've got my family to consider as well. So I think we have to look at it in the broader context and how we can change and adapt when we are faced with these challenges when we go into homes.
And how old was that little girl?
She was 4.
And just for both of you, in terms of the challenge, do you feel different now on the 20th of May to the way you felt on the 23rd of March when lockdown started, or much the same?
I think it's variable, if I'm honest. I think at the very beginning, it was how are we going to adapt to working from home? And it felt alien and I don't like this. And then I went to a period of, actually, this is quite nice. I'm quite enjoying it. And I think now I'm much more reflective that it can work, I think, of a mixture of both. It would be great to get back in the office to see colleagues and have those natural breaks and conversations and reflection on our cases and downloading with each other. But I think less travel is certainly more productive, and it's enabling us to get meetings up to date a lot quicker, I feel, because I'm typing quite often when I'm holding a meeting now, which I wouldn't do if I was holding it in a room. So I think it's variable on each day, but overall I think there's a mixture of more confident about working from home, which I didn't have at the beginning.
Tracy, how about for yourself?
Yeah, I feel that I've adapted. I think most things, you're faced with a problem and you learn how to adapt and evolve and make the best of that situation. So yes, there's all the things that Glenise has said about how it can be improved. I absolutely agree with, and I think it's just a continual process of adapting and improving as we go along. I would say every meeting that I conduct, I'll think of a different way that I could have improved it from the previous one, bearing in mind the circumstances that we're working on. So it's just a continual process.
And in terms of the relative safety of individual children and young people now compared to the way you were working before, what are your worries or reassurances about that? So in other words, children you've been working with all the way through or know all the way through, whether you feel their safety is being compromised or not.
Again, I think the children that we've been working with and we've known, we can sort of see by their body language, their expressions, that because we know them, we could see a change in character. I think the risks are, even if we get the parents to walk us around the home with the camera, if there's somebody within the home that shouldn't be there, we've got no idea. And even if we did, it's really hard then to address that if we can't get into the family home, because the child is going to be there. So that's quite challenging. I think with new people, when we pick up a new assessment, it's really hard because we don't know these people. So to sort of try to build that relationship immediately over the phone, especially teenagers, I'm finding more and more don't want to do the videos, they want to do the voice. So that has been more difficult.
Do you feel that our partnership or the main organisations in Suffolk could work differently to give you more authority when you're working mostly remotely? I suppose when you announce yourself, you tend to say who you are, what you're doing. You have to reassure families you're not just there to take their child away and so on. But do you think we could all do more, those of us in senior positions, to pave the way for this type of working with families, so they were aware of what of how you're going to work and what needs to be done, and how it can be, in science of safety terms, a co-production with them as far as possible? For example, could certain people carry out their own self-assessment more, supported by professionals, than we do at the moment? Which of course is complicated in abuse and neglect cases. But do you think we can do more as a partnership or as a set of organisations, or not?
I think that's a really interesting thought going forward. I think the more that you get parents able to recognise and want to make changes, the more likely they are to happen. So by asking them to sit and think about it, reflect about it themselves, is a really important way forward. It can only be really, really helpful.
And can you think of any other changes to the system, or any other innovations that may help us or help children and families as we go into the next phase? You
mentioned earlier about Chromebooks being supplied by some other local authorities. I think that's a good idea, because I don't think all families have equal access, or as time goes on that might become more apparent, because of the money they've got available. It depends on the equipment that they have available. Some families I work with don't have video capable phones. So I think making sure everyone has equal access to services if they remain remote is really important.
Yes, it may be worth thinking about on a case-by-case basis, where it's part of the protection plan. But I think there are some things that have gone on during the lockdown, like GPs in primary care making weekly calls to shielded people, that and also sending text messages to patients, that whereby maybe the savings in professional time on face-to-face work can be put back by enabling vulnerable people to participate more in their own care and protection. Just a thought. Okay, let's move on and have a look at, I suppose, the dilemmas we've got maintaining this over a long period of time. Because to some extent, everybody's wanted to go back to some degree of normality, or most people, back to school, back to work, back to restaurants, and so on. So if that doesn't happen, do you think there are, in terms of the rhythm of this, anything else that's a concern if this goes on for the next 6 months?
Well, I think children not being in school, because obviously we're not getting the school referrals. And there is and obviously with the recent government announcement about younger year reception in year ones going back on the 1st of June, there's a lot of uncertainty. And I know from families that I've spoken to, there's a lot of anxiety about, if they're making the right decision. So I think, obviously we can only advise them that is their decision and support them to feel empowered to make that decision. So I think, the schools is the challenging one, which I'm seeing at the moment.
I think there's a potential for delays for some children that are subject to care proceedings. I think there's a challenge in having final hearings without parents being able to be present in person. And I think the courts are finding that a difficult decision to make. So potentially some children could end up with their decisions about their long-term care being delayed. So that would be problematic if that continued. A different way of managing it would need to be found.
Yes, you mean in hearings for placement orders and
for final hearings? Yes, for making the final plans for children.
No, I think that's an example of some of the systemic delays that now some of these hearings are being listed well into next year already.
Yeah.
And
it causes distress to children that the children that want to know where their final place they're going to grow up is going to be. That can cause distress for children.
Yes, I think that is an issue to pursue nationally and locally through family justice boards.
Yeah.
Yeah. Can I ask you both, and I asked the same question of our practitioners in the adults webinar about safeguarding adults, but what's important, especially when you're working more on your own, is that you feel well supported and supervised, because this is draining, emotionally challenging work, emotional labour. So can I ask you both work for Suffolk County Council, but it's probably a question more about all employers during this period. Do you feel well supported?
I've never had
by your employer.
I've never had so much contact.
Tracy.
Hi. Can you hear me?
Yes.
Yeah, we have an awful lot of contact. We have an hour meeting twice a week in a video call as a team with our line manager, which we wouldn't have had that many face-to-face meetings. We would have met once a month, maybe once every 6 weeks before then. So much more face-to-face time, even though it's over a video call. And as a county service, we have talks with each other as frequently as people want them to, and that over some periods of time they've been several times a week. So an awful lot of contact, increased to acknowledge how different people might be feeling at the moment.
Yeah, and from my point of view, up until recently, we've been having daily team meetings, which have just recently been reduced to 3 times a week. Equally, the support has been phenomenal, actually, and it's there. It feels that we can access it a lot easier in many ways, because we can drop a message on Skype and just say, when you're free, can you ring me? There's been weekly psychologist meetings for our wellbeing set up every Wednesday afternoon. So I think from Suffolk County's point of view, they've been really proactive in looking at ways to support us in a really unprecedented and changing times.
Thank you both, and yes, I would suggest to all other agencies that who are listening in, that is the standard to reach, that your frontline staff feel that way, because you can be in isolation but not isolated. I also just wanted to say a little bit about some changes to service configurations, and ask you both about the greater use of helplines. Just as referrals have gone down, apart from domestic abuse and mental health, there has been an absolute explosion of use of helplines. And this also tends to happen during crises. And it almost invites us to have a permanent duty service where there's a permanent response to immediate need. Of course, we have that through the MASH and various other mechanisms. But do you see any need to change the way services are provided to recognise the way people are now accessing them?
I think an extra service is always helpful, but I also recognise the really important relationships that social workers have with the families and the children that they're working with. And I think that's the backbone of what makes changes in families is the quality of the relationships that social workers are very good at developing with the children and families that they're working with. But I think any additional service can only be helpful too for specific areas that people might experience difficulty in. But I think the quality of the relationships that the social workers have is very, very good and very, very beneficial to children and families.
Yeah, I echo that, because I feel for us to know how a child is living, to see that, we have to be really to go into their home and experience that with them and almost be a part of that for a short period of time.
Thanks both very much. And you talked about social care, but of course the partnership is wider. We have a senior health professional on our Q&A panel, and we're also responsible for multi-agency working of how detectives and police officers work, how education professionals work, and so on. So we're coming to the end now. So the Q&As have been mostly quite detailed. I hope you feel they've been answered well, but the answers may come after the webinar finishes. And I just want to say a little bit about that by starting with we were trying to get a feedback form online, but that's not been possible. So you're going to get an email afterwards with a link to give feedback, and that will be hugely important to fill out. It enables us to plan future webinars. We've been thinking of having topic-based webinars monthly, but only if this one's worked, and we can learn the lessons for the next one. I want to also thank Tracy and Rebecca and our panel for all their work today. Tracy and Glenise, I do apologise, and the panel for all your work today. Further information about this is on the website www.suffolksp.org.uk. We have been recording the webinar, and that will be on the website soon, not doctored in any way, I do assure you. And also, I'm now just going to pick up, I think there's a final question that's come through the Q&A panel. So no, can't. Yeah. Well, their themes are really coming through. The first is the concern about mental health provision for children and young people. That's a pre-existing concern, clearly, in relation to CAMHS and other services that we've been working with providers on as a partnership. And the second is, how can we ensure we're supporting Black and minority ethnic children, given the disproportionate impact of COVID on them, and with the implications for safeguarding in schools. And I just say about that it's important for not just health professionals, but all professionals to be aware of that extra risk they carry, but also that children and young people and their families with underlying conditions, health conditions, carry. So there are a number of high-risk groups that it's going to be hugely important as restrictions are eased, not to lose sight of, not to suddenly pretend, well, everybody's back to the way things were, but that if you're in certain high-risk categories, the difficulties of re-entry are disproportionately higher. If you don't already, do follow us on social media. The messaging that we're putting out will, I hope, help you in your work. It includes messaging about staying alert, protect children, save lives. And if you're staying at home, as many people still should be, that doesn't mean you should be staying at home to be put at risk. And therefore we need to be ever vigilant. And I'd then end by thanking you all and thanking the safeguarding community in Suffolk for some incredible work over the last few weeks, which in my experience is unparalleled. Excuse me, unparalleled. That's a good point to end on, as my voice has gone. Bye, and thanks very much.